after that Shamala patient went for review to Lexington Hospital, 9:10:50 am. Shamala patient. So Shamala patient data we have to take. Shamala, what is it? It will go to the review reference. Okay, here, so it was referred out. It was a planned. Time was 9:10:50. 9:10:50. Then it will be in time. Outpass was given yes. Diagnostic no. And they went to review to Lexington Hospital. Same thing. And now the same thing will go to ambulance also because they used our ambulance. Here. So this Lexington I will put. You know what happened? Sorry. Copy and then paste it here. Now only the timing. Timing was 9:10:50. So I'll put the timings. 9:10:50. And the same timing we can put like 5 minutes before we called the ambulance and then the ambulance came back. 4, 5. Done. Okay, done. Then